prior to Christmas. On the usage, bit of slow progress in that, but again, we're working with the provider and working with service management teams through the senior management team as well, via the operational governance board, to get the usage percentage up to get staff using the system. That's been offset slightly by a lot of home working, whereby the system wasn't potentially getting utilised to the same extent. But again, we've been working with the service management teams to highlight what should be getting done around that, and that should improve the usage as we move through the coming months as well. And we hope to see that going up significantly as soon as possible. Incidents again reported. As you can see, there's a heck of a lot around COVID, as we know, and obviously with the new variant now getting well publicised across the media outlets, that's likely to continue on. Whether it goes up, whether it goes down, I don't know. We'll see what happens around that. But you know, the incident trends are certainly reflecting what we were seeing before, including that huge COVID spike, which is obviously for all of us to see. But again, we continue to look at other aspects, not just the COVID aspects around the incidents, to make sure that any identified incident trends are being addressed at service level, and making sure, importantly, that the staff within those service areas are getting any feedback on any forms that are coming in where it's led to improvements being made. So it's not just a case of you fill the form out and it falls away. There actually is a bit of work getting done in the back of those. A number of them, doesn't happen every time, but where incidents are reported and improvements are maybe required, or there's certainly a new process put in place, or whatever it may be, that gets fed back to operational staff or staff who are completing these forms, to give them the assurance that it's being listened to, it's being looked at, it's not just getting recorded but being acted upon. And that continues as well, again with close consultation with trade union colleagues and management teams. And finally, that final point is we've got new safety signage, as you'll have seen in the appendix. Again, that's just to reiterate the key points around the ongoing guidance that's coming out from Scottish Government around our COVID controls, and that should bolster some of the stuff we're finding within those spot checks that I talked about earlier on. So again, we've made those as generic as possible, so if there are any tweaks and changes across government in the coming months, it's not going to offset the fact that the information in these signage is quite generic, and a prompt for staff just to remind us all what we need to continue and keep doing around this COVID pandemic. So that's the paper today, and I'm happy to take any questions, Chair.
Okay, thank you very much, Norman. Any questions from members? I see Councillor Dodds, I think, was first, followed by Councillor Houston, please.
Thank you, Chair. Yeah, great report, Norman. Just one question: when you're doing your spot checks, I appreciate it's not all COVID related. No. Are a fire extinguisher suit still being annually serviced? Do you check those as well as part of your check?
We do, and I see Brian nodding there. We do, and Brian being a trade union colleague, and anything that we find out with the fire maintenance councillor, we pass that back to Tracy and our team to make sure any gaps that have been identified, and there's not been in many that I can think of, that certainly goes back via those routes and get that addressed with the fire contract. Yep.
Because I mean, there are a number of employees who are still or are actually working in the office, so you need to make that's fine. That's brilliant. Thanks for that. Cheers.
No bother.
Okay, Councillor Houston was next, please.
Thank you, Chair. Norman, thanks for the report. I must say, when I read it, I was greatly encouraged by it. I think it is a very good report. But I really wanted a couple of things. Are you happy with the arrangements in when people are removed from their normal job? We're having to move resources around to meet various demands. So the flexibility of some staff has been great. But with it, when you're moving into a new environment, it has an increased risk. So any signs of that? And a general question, I suppose, is either what is it currently that's keeping you awake at night, or if it's not keeping you awake, what is it that you're paying most attention to now that's kind of at the top of your agenda?
Okay, I'll answer the ones in turn. We work closely with service teams, councillor, where staff are, moving, and we have had a lot of people moving. They're not going back to the normal office environment. They're not going back to the normal base where they possibly were before, and some are as well. we work closely with the services, and we do get inquiries coming through management teams and from general employees, and we do provide them with that assurance that very much as it sits with the service management teams, we're there to help support the management teams through those changes. So it's making sure they've got the proper DSE equipment, making sure they've been provided with adequate induction if it is a different building or location that they're operating out of. So quite comfortable with that. We do get the occasional query on that because obviously people are getting anxious and they're getting moved around and it's not familiar to them. But it's very much work ongoing. And where we do see little gaps appearing in that, we, the health and safety team, work very closely with the manager around that to ensure that the staff have got those assurances in place because they're already anxious because of that. It's just making sure, and we use HR colleagues very much around that as well. So hopefully that gives a bit of assurance around that. What keeps me awake at night? Right, okay. I suppose in recent weeks, this Omicron is a concern because we don't know how that's going to impact on us. They don't know enough around it yet. But again, that could potentially come into play around our new ways of working and how what you just touched on there, staff moving around different buildings. That might come into play a wee bit more in the coming months. But until we get that intelligence, I suppose that's quite high on my thinking process because we've got a suite of guidance materials as well that we keep up to speed. But again, depending on what comes out the coming weeks and months, that could then lend itself to be more changes, more communication having to go out around council to keep employees and staff up to speed with what changes are taking place, and then updating everything as we go along. As we know, in early pandemic, it changed. It was so fluid. There's nothing to say that might not happen again. So I must admit that's quite high in my thought process, the impact that's going to have. So we're continuing to protect our staff and keeping our own guidance and communication channels open. And the other thing as well, I mean, it's not so much keeping me awake, it's still very much high in the agenda as risk assessment. As much as we're bringing risk assessments and raising the profile of the risk assessments, it's making sure that the risk assessments doesn't just get to a point and just go, good, we've got those covered, move on. We need to make sure that those are live, living, breathing documents and they're getting revised and continually updated where required. And again, it falls on the back of not just COVID, but other environments out with just in the health and safety environment. We need to make sure we're looking at all aspects of health and safety and not just the COVID aspects as well and get that. So probably risk assessment will remain high in the agenda, Councillor. The COVID, this Omicron, I think could lead to some other changes potentially. But again, we'll need to wait and see what comes out central government from, Scottish Government around those. But those are the kind of big watchwords. And lone working's there as well. We need to get the usage up around the lone working. It is a paid service. We're providing it for staff who have been identified as being at risk and require the use of that lone working system. It's making sure they're using it in the right environments when they need to do that. So a lot of work ongoing around those key elements. So hopefully that answers your question there.
Thank you very much. Thank you.
Thank you.
Okay, thanks, Tom. I think the order was Brian Wilson, Mr. A, and then Alistair Tolmash. Brian?
Thank you, Chair. Brian Wilson, GMB Branch Secretary. In response to Councillor Dodd's inquiry regarding fire extinguishers, as Norman says, they are definitely checked when we're out and about. I can only think of a couple of instances where a single fire extinguisher had been found that had been missed when the annual servicing was taking place. Fire blankets would be more of a concern for myself. There is a bit of a discrepancy between the signage for the fire blankets, specifically with regards to them being suitable for adult clothing fires, when in reality the fire blankets generally are newer and are smaller, 1 metre squared, which isn't a suitable size for an adult clothing fire, but that's something that management are aware of and are looking at. My concern would be round about the Omicron virus that's circulating, and it's probably about 3 months ago now, the room capacities were taken down from the individual rooms within offices. The room capacities have been identified based on social distancing and ventilation, etc. It is concerning that particularly with the Omicron variant circulating, that the room capacities haven't been reinstated to restrict the number of individuals within a given room. For myself and corporate health and safety, I've been in some premises. A room that had previously been suitable for example, 2 had up to 4 or more individuals reported to have been within it that day, and myself and my colleagues from corporate health and safety were sweltering. Just standing in the room at that time, certainly didn't feel well ventilated. I would certainly agree with Norman that the number of and quality of risk assessments has significantly increased in the last year or two. They do have some concern still over the number that are shared on SharePoint. I was just having a quick look prior to this meeting, and I noticed a service that had over 100 the risk assessments when I'd last looked, which admittedly were over a year out of date, or sorry, up to a year out of date. They're now sitting at 26 risk assessments which are within date. I'll have to speak to the service to find out what happened to the other 70 odd or 70 plus risk assessments.
Okay, thanks. Take that as a comment, I think, rather than a question. Mr. A.
Thank you, Chair. Daniel Aljo, EIS Health and Safety Rep. It was just a question with regard to the risk assessments. In the document, it says that schools, learning and education are going to use a different system. We'll be using GLOW as a repository for risk assessments because teachers can't access SharePoint. I was just wondering if we could have a wee update on what progress has been made there and maybe get a sort of timescale as to when this might be live. Thank you.
If it's okay, Chair, would that be possible to defer that to education colleagues on the call?
Yeah, is anyone able to provide feedback just now, or should we respond out with the meeting? There's Bryony.
I was awaiting Aileen. It's Bryony Monaghan, Interim Head of Education, but Aileen has her hand up, so I'm going to also defer to Aileen, please.
Hi, Aileen.
Hi there, Aileen Moore, Team Leader and Resource and Business Team within Schools, Learning and Education. So yeah, we have the system set up within GLOW for each individual school to input their risk assessments to that. We also have GLOW logins set up for centre-based staff, so some of Norman's team, Brian, Lorraine, other, well actually no, Lorraine did have access, but other staff who didn't have access to GLOW, that's now been set up. We just have to test the system to make sure that it works and that everybody can get access to it, and then schools can start putting their risk assessments in. But we have been acutely aware of the pressure on schools right now around about COVID, and so we haven't pushed on with that as quickly as perhaps we would have normally have done, and certainly we would have liked to have done, but we are in the process of doing that.
Okay. Can I just ask on that then, is it possible for one school to see another school's risk assessments, or are they kept on a school by school basis?
So it's been set up that they're there for everybody to see, so we wouldn't be putting on individual risk assessments on there. It would be generic risk assessments, and the benefit of that and the reason why we've done it like that is so that other schools can see others' risk assessments and perhaps share good practice, etc. So yeah, everybody would be able to see everybody else's, and so would the centre-based staff. So, you know, anybody else, Norman's team, or I keep saying Norman's team and Brian, but that's generally the people who didn't currently have access to GLOW, they would be able to see them all.
Okay, thank you.
Okay, thank you. I think Alistair Thomas was next.
Yes, thank you. It was going back to the spot checks. When spot checks are done and things are found that need to be done, is there a system to record that on the people that were responsible, and actually it needs to be done by a certain time, and then do you go back to that?
Yes, yes to both points, Councillor. Yes, so we've got an MS team. Well, it started as a Power App. It's actually a SharePoint forum. But what we do is we collate every time an officer comes back from a spot check. We've got a duplicate, basically a form for taking notes. They then upload that onto the electronic system, and then that historical evidence sits there. We use the evidence gathered within that to then notify management teams where there's maybe some points that they need to consider and get them sorted. What happens then, these are done in a cyclical manner. So when they go back, so the same officer will go back into that same establishment, whether it's another month or a quarter, and then they'll have that last reference report to go from to focus on what didn't happen the last time, but also check all the other aspects around that. So we have the check-in, we have the tracking, and we'll also, come early new year, we'll have that reporting facility where I'm working with the business management team at the moment to get an appropriate report to provide that assurance to the operational governance board and the senior managers sitting there, so they can see what we're finding, and then we can show month on month. That was in October, here's where we are in November, and you can see those gaps closing, just to provide that assurance, Councillor. So yes, very much a system driving that.
Okay, thank you. I'm not seeing any more hands up. So last opportunity for item number 5, or are we content to note the recommendations that are there?
Mr. Aldridge's got his hand up.
Sorry, one more hand.
Thank you, Chair. It was just to go back to the improvement plans. In the document, it says that they are live on the MS Teams Power App. I don't have any access to it because my email address isn't stirling.gov. And that's quite common for most teachers. Is there a way that we can get around so that I can see the information that is kept on SharePoint and similar? Thank you.
Within that reporting process, Dan, there are key contacts identified in each service area. Those key contacts would be the people who have got access to work with the management team, help update the plan and run any reports off of that. So if you are out with this meeting, can certainly pass on who the key contacts are, and you can touch base with the appropriate people in service to get that information you require. It'll also be discussed at Education, Health and Safety meeting.
That's fine, thank you. I've got one other quick question with regard to the signage. Is that to go out to all council establishments, including schools?
Yes.
Okay, thank you.
Okay, thank you. We've got 2 further hands now. I don't know who was first between Councillor Houston and Brian Wilson.
Mine was very quick. I was just going to suggest to Norman, is it not possible just to add Mr. Aljo onto the list, rather than get him to require to go and find somebody else to give you the information? You know, he's participating in the panel. Getting him access to the information is actually quite important, so that he can have it firsthand and look at it. Is that not possible within the circumstances, the organisation that we've got?
Yes, we can look at that, Councillor. We can look at all the trade union reps to see how that would tie in with the system. Yeah, there's, it's not a secret. No, absolutely.
Yeah. Thank you.
I certainly have seen some colleagues in education that have both a Stirling.gov address and a Glow, I think it's called, address. So I don't know if they get everything twice or nothing at all, but hopefully it's at least getting them one way or another. Brian, your hand's up, please.
Thanks, Chair. I was wondering whether it might actually be a good idea to start having the improvement plan circulated with the relevant bipartite or health and safety meeting. It's probably been a couple of years since I've actually seen an improvement plan at one of the bipartites, and they were handy when you did get the opportunity to examine them.
Yep, I can come back on that one as well. Again, the last few months have been about building that intelligence and getting the information built onto the new electronic system. So yes, it's a standing agenda item at health and safety meetings within service areas. So as part of that, certainly the service contacts within those service areas, Brian, can run a full report on that, and you can run it off as a Word document or a PDF document. The key contacts have that ability to do that, and it can be part of the agenda items and sent out as papers prior to the meeting. Yep, absolutely.
Okay, thank you. Okay, are we content to note the report then, colleagues that are on the panels?
Aileen Moore, hand up.
Oh, you're along the bottom. Sorry, Aileen. Yep, go for it.
Yeah, it was just to clarify the thing around about signage in schools, particularly for Dan, in relation to the question. So the new corporate signage is going to be shared with schools, but our intention is not that we would be taking down any signage that we already have up. This would be to enhance what's already there. So obviously we introduced signage into schools year past August. So yeah, we wouldn't be taking down what we've got, but would be using this to enhance it.
Okay, thank you very much. I'll do my final check. Definitely no more hands that I can see. Panel members, have we agreed to note the contents of the report, please?
Agreed.
Agreed. Agreed.
Okay, thank you very much. We'll now move on to item number 6, which is our occupational health activity report, please.
Thank you, Chair. It's myself, Kirsty Leishman, HR Business Partner, who will be providing the update on that one. So in terms of health surveillance, there have been 625 appointments from April to October 2021, and this is an increase of 5% compared to the same period in 2020, but it is still a decrease of 46% compared to the same period in 2019. At the moment, health surveillance referrals are not yet back to pre-pandemic levels. However, to address this, we're working with occupational health to make arrangements to resume face-to-face appointments where necessary, and this should be in place in early 2022, and this should allow us to catch up with any backlog that we've got at the moment. From April to October 2021, 117 appointments were not attended, and we've done a bit of work around an analysis of reasons for non-attendance, and we've identified some main issues around us holding incorrect personal information, employees being unable to answer their phone due to work commitments, and also there being kind of no communication of employees having annual leave or other time off arranged. So at the moment, the HR team and the health and safety team are currently working together on a campaign to raise awareness of responsibility of both managers and employees with regards to health surveillance, and we hope that this will be rolled out early in 2022. There have also been 2,064 referrals to OH from April to October 2021, and this is an increase of 31% in comparison to the same period in 2020. The figures for 2019 are more comparable, with there being a 7% reduction in referrals in comparison to this same period in 2021. In relation to wellbeing activities, the revised menopause guidance was approved in September, and sessions for managers and employees continue to be provided as detailed in the report. The HR and OD team are also rolling out a winter wellness programme for staff, which should be communicated this week. And this programme will offer staff access to online sessions with regards to various health and wellbeing topics. And the programme will be continually updated throughout the year with kind of new topics removed or added seasonally. The Council have also undertaken a flu vaccination programme, and as of the 31st of October, 398 employees had received their flu vaccination. I'm happy to take any questions on the report.
Thank you very much. Douglas Dodds, please.
Thank you. Yeah, on page 32, paragraph 2.5, 2.6, I'm concerned that when it says here that staff are not being able to take calls because of due to work commitments, but surely we must try and managers must try and make them available for these calls, because it's important that if they're into the occupational health system and they're requiring assistance from the occupational health, they must be able to take that call for the benefit of the person that requires that call. And when it says multiple appointments, again, that's down to the individual as well to make sure, right, if they've got multiple appointments that they deal with it or combine them together. It's just a bit worrying when it says, employers have been unable to answer due to work commitments, and that to me is worrying. So we need to make sure that the employees, right, have the facility and have the time and have the ability to take those calls from the occupational health. And I hear what you said, that you're into it and you're asking, but we need to push that to make sure that they're not missed off. Thanks.
Yeah, that is part of the campaign that we're kind of pulling together at the moment, is to make sure we raise that awareness with managers to ensure that when the appointments are booked, that the employees given adequate time. I think what we've kind of found in the past, that they've maybe been put on a piece of work that isn't easy to remove themselves from for that period of time. And what we want to do going forward is ensure that when the supervisors are assigning work on the day of the appointments, that the employee is based somewhere where they can remove themselves quite easily in time to take the calls.
Great, that's reassuring. Thanks very much. Thanks.
Thank you. I've got a few hands up there, but I think it was Alistair Tolmash, Mr. A, Brian. We've got Abigail as well. I think in that order. Alistair.
Okay, thank you, Chair. It was to do. We still have quite a lot of our staff working from home, and a concern that I would have, that will bring forward a different the health things for staff than was before. Has that come to the fore? And is there a regular way that managers contact staff to see that they're doing okay, because they won't have the same kind of interaction actually that they had before?
Yes, I mean, certainly we haven't kind of logged or kind of done any analysis on whether there are different health issues coming up. I think we are kind of more aware of there being a bit more of a requirement for different types of DSE assessments to take place and different equipment required because staff are home working. In terms of contact, I know from my own point of view in attending kind of service meetings and meetings with managers that we do encourage managers to be having team meetings with their staff, even if it is still on Teams, just to catch up, but also to have those one-to-one meetings with staff who are home working to ensure that there's regular contact. And we're also encouraging staff to kind of communicate with each other in their teams as well, just with other colleagues for additional support. But it's certainly something as a team we can continue to raise at service meetings that we're in attendance at.
Okay, thanks, Chris. I think Mr. Oljo was next.
Thank you, Chair. I was just looking at the statistics of positive cases for COVID-19. Looking at the numbers, 47% of positive cases are from schools, learning and education. Is there anything behind that statistic? Because it is notably higher than other services. Thank you.
I think, to be honest, we haven't done a kind of deeper analysis of why there might be higher numbers. I think what we have noticed from the figures is that the numbers are higher in the services where we do have more employees who are having to kind of physically go into the workplace rather than their staff working from home. We can kind of see that the staff in areas where there's mostly home working or all home working, the figures are much, much lower. So, but no, we haven't done a kind of full analysis, but it's something that we can look into going forward.
I think that would be interesting to have a wee look at. Thank you.
Okay, thank you. And I think the next order would be Brian, Abigail, Norman.
Thanks, Chair. Obviously, the GMB welcomes the return to in-person testing. Certainly our members had been expressing concern over the inability to do the audiology testing or the testing for the white finger, vibration white finger. I'm slightly surprised at the low numbers being referred to counselling, because certainly my experience in the past year is that there's a lot more members coming forward in need of counselling. But I do notice only figures to October, so it might end up being about the same number as previous years. But certainly we welcome the return to members being able to get tested for the audiology and also the vibration white finger.
Thank you. Abigail was next.
Yeah, it was a few points that I've got here. We welcome Unison welcomes all the work that's been done around menopause, and you know that's really been successful, I think, and we'd like assurances that that's going to be done as a kind of rolling programme, because obviously it's not something that's going to be going away. So that's one point. The working from home point that Councillor Tolmash made, I think in terms of health, we also need to be really recognising the emotional well-being, and that ties in with what you were saying, Kirsty, about the well-being initiatives that are on the go at the moment. And I suppose my concern is that we don't want to get into a situation where we're doing a kind of top-down, this is what we're offering for your well-being, that we really need to be taking the temperature with staff and finding out what it is that they really need in order to feel well while they're at work. And particularly with people working from home, we know that staff have been working really hard when they're working at home, but the challenges at home are very different from the challenges of going into the office. So that was really, it's more points, I suppose, than anything, but it would be quite good to have reassurance over what HR are planning to do.
Thanks, Abigail. I mean, certainly on your first point with regards to the menopause sessions, we do have commitment from occupational health that they'll continue to run the sessions for as long as we're still seeing uptake, and it does form part of this wellbeing programme that we're rolling out. So we will continue to have the sessions, and we'll continue to make sure staff are aware of them, so that if there is that interest, the numbers continue to be up to a point where PAM will support the sessions. In terms of the kind of emotional wellbeing side, I think it's a really important point that you've raised, particularly in terms of kind of asking staff what it is they would maybe like us to run. And it's something I can feed back to the kind of group that are working on this kind of wellbeing programme at the moment. Some of the sessions we do have planned over the next few months will probably pick up on a bit of the emotional wellbeing side, particularly for staff who are home working. But it's certainly something that I think it would be a good idea maybe in the new year, once we've had the first few sessions, to kind of roll out to staff, asking what things have they enjoyed, what would they maybe like us to do going forward. So that's certainly a good suggestion, Abigail. Thank you.
Okay, thanks. I think it was Norman next and then Alistair, I think's the order.
Before I get my obligatory once a week, you're on mute.
Yeah. First £10 fine. First £10 fine. On mute.
Well, that's a new one on me. £10 fine. Okay.
For charity, of course. For charity.
Of course. Really, it was just to pick up on a couple of the points that were made there. So again, just to welcome, the winter wellbeing event, because I had discussions with Pamela and Kirsty and others in HR, and we're going to be part of that in terms of the health and safety aspects around that. But it's really just to say that there has been guidance, and it's been updated again on the back of the HSE. They've not changed their focus. They've just highlighted much more in the last month, I would say, on guidance around the focus on home working, not just home working, but actually working in the office, around stress, around making sure people have got their coping mechanisms in place, and it's been well made here today. So I think it's quite timely. We're having those check-ins with the wellbeing programme, and I welcome what HR are doing with that. But again, it's also that part where management teams have always had that chance to work with teams through the pandemic, where they're checking in with home workers, which is certainly, I know management teams are doing that. It's having regular one-to-ones. It's just having not even a formal one-to-one. It's just a check-in to say, are you okay? It can be as simple as that, and let people have their offload, because it can. I've been sitting here personally, I can say I've been here since March 2020, and it can feel a wee bit kind of cabin fever at times, and it's good to get that touch base and just have a sounding board, even if it's just to have a wee moan or a thank you, So I know that happens across the board. So I think these programmes that are coming, I think they'll be embraced by the staff. And I think the point that Abigail made was well made. It's not just about giving stuff because we consider it to be the right thing to do, but what do they actually need as well? So really good points there. In the guidance for working from home and working in the office, we've actually taken that HSE. I very much use the HSE as that's my benchmark. We work to that. So there is such a focus on mental health, because people do struggle at times. But we work closely again with HSE, with HR, because we sometimes get queries coming in from individual members of staff, and we do signpost where we can, because a lot of the time it is just around getting something out, So it's important, I think, those two-way conversations happen as much as getting the work done. There's also that personal side to it as well, and I certainly know that's a focus for management teams across council. And the other point was, again, it's just a comment to say I actually went to one of the menopause sessions, and I found it very, very interesting, very informative, because not only has it helped me with my professional life within the council, but in your home life aspect as well. So I'm not going to give any ages away, but it was really quite good to get that information and open up people's minds as to what you think it is to actually what it is. So no, just to say thank you for that. So that's me. Thanks.
Thank you very much, Norman. Yeah, some good points. And Alistair, you were next on the list, please.
Yes, purely by coincidence, and I do say that I pay, that I am listening to the meeting, but an email crossed my computer, winter wellness, actually, okay, when we were speaking about the subject. So whoever sent that out actually knew the timing.
I'm sure it was a complete coincidence. I've no doubt at all, Alistair. But no, thank you for that. Okay, folks, we've got no other hands up on that item. So if I could ask panel members if they're content another noting paper to note the report, please.
Yeah, agreed.
Yeah, happy agreed. Yeah.
Okay, thank you very much. We'll move to the next item then, which is item number 7, and it's any trade union workforce update from JITUC. It's a verbal update, so I don't know who wishes to speak first, or if one's speaking or not on behalf of all. Any hands up? There's Abigail. Thanks, Abigail.
Yeah, sorry, I'm kind of catching up with all the things that are happening with the branch because I've been off for a little while, but I did hear that there are issues around the state of the showers in land services again. Now, I know that there was a big piece of work done a couple of years ago to have a deep clean and get them sorted, but apparently that needs to be revisited. I'm not sure if Norman's aware of that or if that's come up on any of the inspections, because I haven't been on any of those joint inspections yet with you, with the health and safety team. And the other point that I picked up from the branch was around the porta cabin at waste still not having been put in place. Now that's been a long time, so I'm wondering what's happening around that.
Bruce Ricky's hand went straight up there, so Bruce must have an update for us on the latter.
Thanks, Councillor Gibson. It's Bruce Reekie, Senior Manager for Environment and Place, and thanks for the update there, Abigail. In terms of the showers for land services, it's certainly not something that's been reported up to us through the service bipartites, but certainly it's something that we'll pick up in due course as well. And if there are issues there, we'll obviously get them resolved in quick order as well. In terms of the porta cabin down at Waste, the issue there is actually trying to find a suitable location and also getting the power connection put in as well, given the location of the existing porta cabin as well. I'm aware that there's temporary arrangements being put in place for the staff, obviously, over the winter period, but it's certainly something that we're looking to take forward early part of next year in terms of trying to find a more suitable accommodation for the workforce down there.
Okay, thanks for that, Bruce. Mr. Aljo, please.
Thank you, Chair. It was just a quick question with regard to day cleaning in schools. I noticed Janice is on the call. Would it be possible, are all schools currently, do we all have day cleaners in post?
Janice, please. Janice Fanning, if you're there.
Thank you, Chair. Janice Fanning, Service Manager for Facilities Management. To answer the question, all schools have been appointed a day cleaner. We do have some vacancies just now due to staff taking on other employment, excuse me, but anywhere where we don't have a day cleaner, the tasks are picked up by other staff in facilities management.
Okay, thank you.
Janice. Okay, there are no other hands showing on that item, which is the final item for today's meeting. So on that note, I'll close the meeting with the thanks for everyone's efforts as always in relation to all the health and safety matters to do with the council, and wish you all well. And since Norman's the only one I can see with a Christmas tree behind him, Alistair's got a wreath, just to wish you a very Merry Christmas and a Happy New Year after another difficult year. But we do want to keep these health and safety matters front and centre to all the work that the council's doing. So just thanks everyone for you and your colleagues' continued efforts in that regard. And I'll close the meeting there. Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you, everyone.